So now we're going to talk about the payment process, how that process flows. It starts out with the patient visit to the physician who evaluates the patient, and they document the conditions. This information is then assigned the appropriate diagnosis, the ICD-10 code, and the CPT treatment code for any treatments they receive. The diagnosis and treatment codes are typically documented on a superbill, and sometimes the physician or the provider will check or circle the diagnosis and treatment and add any modifiers to indicate any modifications to the treatment. And then the medical billing specialist will get involved here. This is where they take the superbill, the insurance information, and the patient demographic information and input all this information into the practice management software. This is sometimes referred to as the medical billing software. This is where a claim is then created and uploaded or transmitted to either the insurance company or more typically to the clearinghouse. Continuing with the payment process, if there are any problems with the claim, the medical billing specialist will follow up and find out what's wrong, correct the claim, and then resubmit it. They may also file an appeal with the insurance payer, which could be a written letter or some additional documentation to support the insurance claim. And once the payment's received from the insurance carrier, it's accompanied by what's referred to as a Remittance Advice statement, sometimes referred to as an ERA for an abbreviation. This information is entered into the practice management software, and it's reconciled with the patient account and the claim for that patient visit. If there's any copays or coinsurance or deductibles, the patient statement will then be printed and mailed to the patient. Any unpaid claims require investigation and follow-up to keep the accounts receivable low for the practice, and this is something that the medical billing specialist is involved in frequently. Any delinquent patient accounts may require additional statements or letters and coordination with a collection agency if necessary. So here's a very simplified diagram of the reimbursement process. It starts out when the patient visits, gathering the insurance information and their demographic information and collecting their copay. Once that's collected, the patient visits with the provider and the encounter is documented. This documentation is used to assign the appropriate diagnosis and treatment codes, and all of this information is then collected and entered into the practice management software. This information is then used to create a claim, and typically that's an electronic claim. Very occasionally, very rarely, like less than 5% of the time, a paper claim is created, and that's at that point it's just printed out and mailed to the payer. Electronic claims are then submitted or uploaded to the clearinghouse in a batch, and these are checked for any errors once they are received or uploaded to the clearinghouse. And if they pass that test, pass any checks there, they're then transmitted to each individual insurance company or insurance payer. If there are any errors, those are corrected and resubmitted to the clearinghouse, where they're once again submitted to the insurance payer. If the claim is okay, then it goes to the insurance payer for the adjudication process. The insurance payer adjudication process is just simply the process that they go through to determine the amount to reimburse to the provider if any adjustments are made. These would be indicated on the electronic remittance advice, and the payment would be posted and reconciled in the practice management software. Once insurance payments have been received and reconciled, the patient would be billed for any remaining balance that would be coinsurance or deductible typically. And those statements would be sent to the patient and payment made directly to the provider by the patient for those remaining balances. So that completes Lesson 1, a brief description of what medical billing is. Next, in Chapter 2, we'll be talking about some of the more common terms and acronyms used in medical billing.